Hello, and welcome to Mental Health Matters. I'm your host, Liz Lang. Each week on this podcast, we will break down various aspects of mental health. We are so excited you're here and hope you enjoy this week's episode. Hey guys, Liz Lang here with Jeremiah and Selina from Core Connection. And this week we are going to get into supporting eating disorders. And before we do that, I have this week's parenting moment. And even before we do that, I also want to make the disclaimer that this podcast is for entertainment purposes only and should not be taken as medical advice. So that is our big caveat, big disclaimer right off the bat. If you or your child is experiencing an eating disorder, please seek professional help because it is absolutely critical. Okay, so my parenting moment fits in really well, and it also kind of serves the purpose of introducing a less common eating disorder that is not nearly as complex as anorexia or bulimia, but it is still an eating disorder, and so it's also not as common, but it's worth talking about. So it is called ARFID, which stands for Avoidant Restrictive Food Intake Disorder. And it is classified as an eating disorder. And so it's typically seen in one of two instances. At least this is my understanding of the condition. So neurodivergent kids, so kids who are autistic, will often develop ARFID. And kids with allergies. It's also young kids who have allergies at a very young age, multiple allergies in particular, will often develop avoidant restrictive food intake disorder. And so basically it's a lack of interest in food. And they've said that there's been some studies or some type of connection about, maybe hunger cues and the brain in the body not communicating properly to receive proper hunger cues. But this only became an official diagnosis back in 2013. So 13 years is not a lot of time with an eating disorder. There's not a lot of good long-term study on this, which makes treating it a little bit more difficult. So I have shared this before. My son has been diagnosed with ARFID, and his is definitely stemmed from allergies. I mean, finding out when you're 9 months old, or rather your parents finding out when you're 9 months old that you are allergic to eggs, dairy, and peanuts, that's like what you feed toddlers, right? Those are like all of the big.
Well, maybe not the peanuts, but the rest.
Sure.
Yeah.
but peanut butter, toddlers love peanut butter and jelly sandwiches.
Sometimes, yeah.
Sometimes, you're right, sometimes. But, the eggs and the dairy, those are, particularly the dairy. Dairy is really hard to avoid because there's so much dairy. I call myself a fake vegan because I buy vegan foods. Like they're my best friend. I'm like, yes, vegan. My son can eat that. It's fantastic. And I also buy my milk and cheese that are real dairy. So my son sees several different specialists, and to further complicate his allergies and the ARFID, he's also got what's called ketotic hypoglycemia, which I've also shared before. So his blood sugar drops. It's a really bad combination, not wanting to eat food with having problems keeping your blood sugar up. It's a bad combination. Hence, he is tube fed. So he sees a lot of specialists, and he's had a multitude of therapists, and the kid has more doctors than years of life. And we had what I thought was a setback recently. So thankfully, he is gaining height, which is great, and he is gaining weight, but his weight is not keeping up with his height. And so we recently had to increase the volume of formula that he was getting in order to better manage his weight. And in my head, I was like, oh, this is so frustrating. This is a huge setback because, he was doing so good at eating food orally instead of through the tube. And I met with his occupational therapist, and she said, I wouldn't call this a setback because him needing more food, it means he's growing. So this is a good thing. And I really appreciated her perspective. And it also fits in so well with what we talk about a lot on the podcast of changing your thoughts about a situation. And that's exactly what it was. So is he maybe going to eat less now orally for a little bit so that we can get his weight to a better place? Sure. It's okay that maybe we're going to be a little bit longer on the G tube. That's okay. We still haven't lost progress in his interest in trying new foods, because kids with ARFID, that is a big deal. They often avoid new foods. Like, new foods are scary, they're terrifying, and they're like, no, get that away from me. I'm not even going to look at it. Is genuinely a common reaction. So I really appreciated this occupational therapy saying, no, this isn't a setback. He's growing. This is a positive thing. And we haven't undone all of the hard work that he has made so far.
It's such a common response for parents when maybe things stop going in the right direction in any type of mental health work or even coaching work. We hear that a lot, right? Oh, yeah. I thought we were making so much progress and now we're back to step one. And the reality is we're almost never back to step one. Sometimes we do have to maybe back up a little bit, slow down, reassess things, or change the way we think about things. And that's okay. I love that the occupational therapist kind of helped you focus on your thoughts in a new way, because it isn't a setback. It's truly a step forward, and it's an adjustment. It just wasn't the step forward you were expecting, and that's okay.
That's what I was thinking. What if they told you from the beginning that, hey, if he gets to a certain point that we have to like up his formula and he has to be on the tube, like that means he's progressing. Then you would have celebrated when that happened instead of feel like it was a setback. So just deciding that this is a step that he needs to accomplish to be able to get to the next step would help you to celebrate that instead of feeling like it's a setback. So that's awesome that she helped you see your thoughts and how you could change that a little bit to help it feel like it was going in the direction you wanted.
Yeah, because, with all types of eating disorder, there is this mental component to it. And as I mentioned, ARFID, it is simpler in that there's not as much self-worth tied to it. And you tend to see that more with bulimia and anorexia. But, there is still very much a mental health or a mental component. Oftentimes ARFID can be really closely tied with anxiety and, so managing anxiety. So what I've come to realize in terms of, whether it be coaching or therapy or anything like that, when you put a kid in therapy, particularly a young kid who is, 4 through 6, like my son has been, the therapy is mostly for the parents because you have to train the parent how to deal with this. And it's not even that the parent was doing anything wrong. In fact, most of the time, they've just been coping and trying to do the best that they can and trying to do what is best for their child. And so the therapist's job, or whatever occupation that they are in, their job is to step in and give the parent better tools, different tools to help cope with their child. And, that's a lot of what parenting is in general, is just trying to find new tools and new ways to help.
Well, and that goes right along with a lot of the things that Selina and I teach, Liz, about parenting is most often what we find is that we need to make shifts in parenting rather than trying to change the behavior of children. And the behavior changes because of the change in parenting. And it's such a fun process. And it's not that parents are bad parents. I have to believe, and I want to believe, that most parents are just doing the best job they can, dang it. And it's hard because every child is different, situations are different and unique, personalities are all unique. And so sometimes a little bit of help just goes a long ways for parents in shifting the way they're thinking about something or the way they're managing something in their home.
And this leads really well into supporting eating disorders. And so the idea of this is supporting your child while staying grounded yourself. So, I loved what you said, Jeremiah, about oftentimes we're trying to get the parents to change their behavior rather than the kid. But sometimes kids are genuinely engaging in behaviors that are unsafe. That does definitely fall under the category of an eating disorder, which, again, we cannot stress this enough, is why you need professional help. So our focus today is going to be on how you as a parent can support your child and how you as a parent can honestly support yourself, because the change that needs to happen has got to go through the professionals.
Yeah, today's podcast is going to be more about parents and not about the
Mm-hmm.
actual eating disorders. If you're looking for information on eating disorders, this isn't the place to get that. They're complicated, they're challenging, and every situation is unique and really needs to be addressed by professionals, both medical professionals
Mm-hmm.
and mental health professionals. Typically, eating disorders we want to attack from a couple of different perspectives. And if that's what you're dealing with, go get some help on the side of managing your own emotions and how you're able to still be there for your child. That's what we're going to talk about today as they're going through these struggles.
Yeah, and so if you are someone who is going through this, I can share a little bit of my experience, especially from this multifaceted treatment. So, my son is at an eating disorder center, and so this is a center that specializes particularly in eating disorders. And if possible, that is a really good option for a kiddo with an eating disorder. And so he sees three different people. So he has a nurse practitioner, which is the medical side. He sees a therapist, and he also sees a registered dietitian, which is different than a nutritionist. Okay, that's an important distinction. Registered dietitian is what you want. And so they're really able to hone in on this multifaceted approach to making sure that he is healthy and that we are taking the proper steps. So I do think it is important to understand a little bit about what's beneath the behavior with teens for an eating disorder. So oftentimes it's connected to things like control, identity, anxiety, or being emotionally overwhelmed. And sometimes kids will use food as a way to feel in control because they can control what and how much they put into their body. So tell me your guys' thoughts on why it is so important to see the teen and not just the behavior.
Well, I think it's like anything that we deal with when it comes to mental health disorders is that if we see the child as this eating disorder, that becomes their identity. And that's
Mm-hmm.
something that Selena and I are adamantly opposed to. We don't want the eating disorder to be their identity. They are who they are. They're people, they're human beings, they're your children. And so we want to focus on who they are and focus on our relationship with them instead of focusing on just the eating disorder. Certainly, you need to listen to your doctors and therapists and whoever's working with your children. But when you're managing this, we want to focus on the connection, on the growth as the individual, and not allow or try not to allow this to become their identity. It can be very difficult with eating disorders because often we end up in inpatient facilities if it's too severe because it's such a risky and dangerous situation. But that focus on them as a human being can be super helpful.
I think to help parents get clarity in the situation, and especially what we're talking about, is to realize that this situation isn't a parenting failure. Maybe that will help in your mind to be able to differentiate and come from a place that is going to be empowering to help your child and not feeling like it's things that you're doing wrong is why they are experiencing those things.
And that's also going to be critical for your own well being because as parents, we so often try to go back and play Monday morning quarterback, where we look back and try to think of all the things we could have done differently to prevent this. And it's just not helpful. So, don't get stuck in this, what did I do wrong? Rather, it's going to be so much more beneficial to focus on how can I connect with my child? What does my child need from me? How can I show up for them so that this is something that we can walk through together so that we can develop a stronger relationship? That is going to be way more powerful than looking at this as a problem to fix. Fixing the problem is not your job as the parent. Your job as the parent through this is to try to be, as much as you can, which I understand is going to be difficult, to be grounded, to be level headed, and to try to be an emotional support for your child.
Yeah, so you're not the cause and you don't have to be the perfect solution.
Yeah.
So getting yourself to be emotionally steady and regulated so that you can be there and support your child in the things that they need throughout the process.
Well, the reality is that this can be really scary for a parent, right? If a parent discovers that they've got a child that's suffering from anorexia or bulimia or other eating disorders. There's a lot of eating disorders. It can be scary because their overall well-being is at risk, not just their mental health, but their physical health. And so being able to be calm and be a place of solid stability for your child can be super helpful. It's not easy. That's why we're talking about it today. This isn't a simple thing, because you probably have more questions than answers, especially when these kinds of things first get discovered. I can imagine, Liz, when you were told that your child has ARFID, and you're like, what the heck is ARFID? Like, what does that even mean? And so you start with a lot more questions than answers, but moving forward and practicing calm in front of them, sometimes you're going to be screaming inside, and that's okay. But trying to practice calm in front of them and being grounded yourself and using, a clear mind will really help with the mental side of things for your child and for you. Again, it's hard. I don't want to make light of any of this. These are very complicated and challenging things. And so, but moving forward with a positive attitude, with confidence that we can find the right answers in the right direction, can be super helpful.
Yeah. So I feel like one common pitfall that maybe parents could fall into is trying to minimize it, right? So saying things like, you just need to eat, like making it sound just so simple. And, that can be really alienating to a teen, because if it were just that simple, they would probably already be doing it, right? So, I think wanting to avoid minimizing it, instead, come to their level. Try to focus on the emotions of it. Okay. Like, man, I can see that meals are hard for you. I can see that this is a struggle. I can see that food is hard, and I'm here with you, is a much different response than just pressure or lecturing or ultimatums, right? Those things aren't going to be effective realistically.
Yeah, lectures, ultimatums, you just need to eat. And I know it seems that simple so often, and you're right, it's just not. Or if we're dealing with like a bulimia, like binge and purge type situations, well, just don't eat so much food. I'm going to control how much food goes on your plate and what you have access to. And because we want to fix it. We don't want them to go through this. And it seems so simple. It seems that simple sometimes to us as parents, yet we know it's much more complex than that.
Right. So one thing that you can do is observe without judgment is another helpful tactic, because, there will be times where you probably will need to check in, right? And just kind of see how they're doing, maybe as things are progressing. And I think it is important to check in. It's not something that you just, they're getting help, okay, I can, just step back and pretend that it doesn't exist. That's also.
And again, we're going to listen to the therapist about that, right? The therapist and the doctors.
Yes.
What are the doctors saying we need to do? How are we going to support them? Because
Sure.
They're going to have the information on what's going on with, the behind the scenes causes of what's happening, whether that's some sort of body image issue or confidence issue or whatever it looks like. And so we're going to want to work with the doctors and therapists on how we're checking in. But you're absolutely right. There's going to be times you got to be checking in. In fact, probably quite often.
Yeah. So, saying something like, I've noticed you seem stressed around meals, and, you can follow it up with, help me understand. I want to understand what this is like for you. I want to understand what you're going through, and be open to the idea that they're not going to want to open up to you. And that's okay. If they just say, yeah, I'm struggling, but I'm not in a mood. I'm not in a place where I feel like I can talk about it. Probably a common response you might hear, and that's okay. That could also be another good time to say, okay, do we need to follow up with your therapist, or do we need to find somebody else for you to talk to? But don't take it personally, because when you take it personally, you make it about you, and this isn't about you, this is about them.
Well, you have to understand they're probably scared themselves. And a lot of times they
Yes.
probably don't even understand how they feel or why they're experiencing or why they're doing. And so understanding that and being patient with them, that they probably really don't know how they're feeling and they're probably just as confused and scared.
Yeah, absolutely. Okay, so here's another real life example that you could possibly experience. When your teen says, I'm not hungry, that one's tough because sometimes people just aren't hungry, but you are dealing with an eating disorder, so it makes it way more complicated. What can parents do to offer support?
Well, often I think the simple, easiest answer is what most of us would probably do. Well, I'm sorry you're not hungry, but it's time to eat. You're going to have to eat. And again, probably not very helpful, but maybe a different response, something along the lines of, I hear what you're saying. I get it. This must be really difficult, but I really am concerned about your health and I want you to be healthy. So let's see what we can do to work on this together and figure this out.
And that's probably another instance where the therapist and the doctors are going to have tools to, of what to do in this specific situation. And, with eating disorders, there's going to be, at least for a minor, for adults, it's obviously going to be very different. But if you're a minor, then, parents, they really need to be involved in the process with the therapy so that they can be aware of triggers and that they can know the tools and the tips to help their teen when they have these instances of, I'm not hungry or I'm done eating and they've barely touched their food, right? So it's so important to look at this or try to make this a team effort, because another thing you want to avoid is making your teen feel like they're being ganged up on. I just have all these adults just telling me what to do and trying to tell me what to do. You don't want to create a power struggle. You want to create connection. Let the doctors be the bad guys. You need to be the ally as much as you can. You can't always be the ally with your teen. I get that. But as much as you can, try to be that for your kiddo.
Yeah. And parents, so often we just kind of react, right? Like when we get into these situations where I'm not hungry type of situation where the kid says, I'm not hungry, we react. We're worried.
Yeah.
We're scared. We do that because we actually feel like we're not in control of what's happening. And we like to be in control as parents. And so that reactivity actually can really escalate things and make it even more difficult, just about like anything with our kids, right? Especially when they're teenagers, sometimes they'll just see how far they can push back on whatever we tell them. So really we're looking at becoming a partner in fighting this with our kids and not a control feature of whatever they're dealing with. And so we want to be able to take the time to just hold back a little bit before we respond. Think about what we want to say, make sure that our tone is appropriate and that we're speaking, at appropriate pace instead of kind of freaking out and just reacting. And then we're going to focus on that connection over the control. And then we're going to separate urgency from panic, because sometimes this is an urgent situation and you got to take whatever steps necessary, but panicking isn't going to help. Panicking is kind of what we're doing when we just react.
Right. And, I've said this before time and time again. I'm going to say it again. Give yourself grace. You're not going to get it right every time. And you have to be patient with yourself the same way you're trying to be patient and do what's best for your teen. You have to be patient with yourself. And when you do mess up, it's a great opportunity for repair. It's a great way to go back and say, I didn't handle this right, and be vulnerable with your teen and say, this is hard for me too. And I'm trying to figure this out too. I love you so much, and I want what is best for you. And so I'm just trying to do my best. So, be patient with yourself too and be kind.
Yeah, I like that.
Okay. So balancing support and boundaries. So let's talk about how you can be compassionate and also hold structure. And, again, the doctor's going to kind of have the nuance in this, right? Or the best idea for the nuance. But there are still things that, you can do at home. So let's talk about, compassion with structure.
Well, and really, I guess to me, it's similar to any other parenting situation, right? We have to have boundaries. We have to have balance. We have to have structure in our homes. but we're not just trying to force it, and we don't want to just give up, but we want to come from this place of compassion and understanding and build the connection. And we build that connection through acknowledging and validating what they're experiencing. Instead of saying something like, fine, don't eat then, or I'm going to take away your phone if you don't eat, we might say something like, man, I know this is really hard, and meals are also really important. So why don't we take a moment and figure out what you feel like you can manage right now? And so now we're not saying, hey, fine, you don't have to eat. We're saying, let's discuss what you can manage. What can you handle? And of course, that's going to be within the boundaries set up between you and therapists and doctors. But how do we work within that from a compassionate place and from a place that builds connection rather than just control?
Right. Because a lot of this control is almost at the essence of all eating disorders, because it is often about control. And so the last thing you want to do is create a power struggle. That is what, we really want to avoid. And trying to use this punishment of eat or you lose your phone, eat or you don't get this, that's a power struggle, and that's much less effective of, I hear you, I see you. How can I support you in this moment? What can I do to help you through this right now? Or what do you feel like you can do in the moment?
Yeah.
It sounds like giving opportunities for them where you can to have that control. And it comes back to what you talked about at the beginning, that a lot of this stems from them feeling like they don't have control. And so if you keep compounding that they don't have control, it's just going to keep going back in a circle, right? And so finding those opportunities that they feel like they have a choice and that they have some control is going to be helpful.
Definitely.
Yeah. Putting the control back in their corner as much as possible. Okay. So in closing, being a safe place in a hard battle. So, again, your role is not to fix your teen. Your job is not to fix this problem. Your job is to create safety and boundaries within the limits that the doctor has said, this is what is acceptable. And the thing is, with eating disorders and with the professionals that are trained, they are trained specifically in this. And so they've really got it honed down, and they really dial in kind of everything. And they have a really good approach in the best methods as to treating this. And every patient is unique and individual. So what treatment might work for one patient is not going to work for another. And so that's why it's so important to work with a doctor, because maybe you had a friend who went through this and they say, oh, we did this and it worked great. That might actually be the exact wrong thing to do with your child. It's why the medical professionals are going to be so critical in this. So talk to me about being a safe place for your kid throughout this.
Well, to emphasize again what kind of you already talked about, of having that grace for yourself, like realizing you've never dealt with this before. You're not a trained professional. Maybe by the end you will be, but you got to give yourself that grace and allow yourself to learn throughout the process itself for you, right? And so just being consistent and calm and doing the best that you can and looking for those opportunities, that this is more about being there and connecting. It's another opportunity to connect with your child. And so looking at that opportunity to connect and just being there, being calm and being how you can support them is going to be more important than trying to control and fix it.
Yeah, I think that connection is, that's what we talk about all the time. It's why we named our business what we did, is core connection. Those core connections with our children and with others are so critical for overcoming any struggles that we're experiencing in life, whether it's an eating disorder or something else that's going on. If we have that connection, we're going to be more open. We're going to be able to share more. And when we're open and we share more, then we better understand what's happening and we're better able to get the help and the support that we need. We don't want to create shame. Shame is such a terrible way of living life is to feel ashamed about something, especially like this. You're really struggling. The shame just isn't helpful. And when we become reactive and forceful and punitive, we're going to create a lot of shame. And what that shame is going to do is it's going to shut them down. They're going to hide it from you. They're going to be less open with you about it. And it's just going to make it worse. And so that connection is important. And I think one final note for me is that reminder that progress in these types of situations is not linear, and it's slow sometimes. Just like we talked about with a parenting moment for you, we feel like this is a setback. No, this is just a step through the progress of what we need to do to manage and get through some very difficult situations.
Yeah, I really like that as a closing line, that progress is often slow and nonlinear. So, one day at a time. It's okay to take this one day at a time, because most days are going to look different. And it's okay. It's okay that it's a slow process, and it's okay that, every day isn't a big win. Every day doesn't have to be a big win for there to be progress. So sometimes just surviving is the win of the day.
Yep.
Okay. So next week, we are going to get into supporting teens through burnout, and we will see you all then. Have a question? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com.